So at the Boston Public Health Commission and Healthy Start Systems, we have a number of programs that address the well-being of women, children, families. Specifically, our programs are focused on addressing infant mortality and other inequities in maternal child health for the past 3 decades now, and really focusing on the highest needs from pregnancy through early childhood. So some of our legacy programs include Healthy Baby, Healthy Child. Healthy Baby, Healthy Child is our home visiting program where families get the opportunity to really expand their care team and work with public health nurses, social workers, so behavioral health clinicians, and also public health advocates that really act as community health workers and really have an intimate relationship with families and kind of help them navigate resources and really emphasize the importance of health education as they prepare for their new baby or for postpartum, and really just parenting up to the age of 5 years old. So that's our Healthy Baby, Healthy Child program. And then there's our Boston Healthy Start initiative, which I work directly with. That program is a grant-funded program through Health Resources Services Administration. It's a federal grant. And through that program, we're able to partner with local community health centers that are located in areas that have the highest rates of infant mortality. And it's through these health centers that we're able to provide another community health worker that really helps to help navigate certain needs that they may have within the city. Housing is a big one, just trying to get their basic necessities as they think about becoming new parents or addressing their needs during postpartum. These family partners really help coordinate the care that they're getting in the health center, really advocate for them on their behalf, whatever those needs may be. Again, emphasizing health education, preparing them for the various things that come up, like what is safe sleep, what does it mean to think about healthy eating, healthy lifestyle, how can they incorporate these things into their lives based on where they are in their current situations. It really emphasizes the importance of addressing these things and partnering with families that do have the highest rates of inequities. And so Boston Healthy Start is specific to working with Black women and families. We also have what is called a community action network, where some of these inequities that are very prevalent get to be addressed on a more policy level and community level change. And so it really is a coalition who have really been focusing on 2 key things, which is bringing a local fetal infant mortality review, sometimes referred to as a FEMR, and really also focusing on preconception health. Thinking of more of an upstream approach to maternal and child health and trying to address some of the root causes before families actually become pregnant. So that's our Community Action Network, and it's really probably the best way that folks can get involved with some of the work that we're doing outside of being participants in the program. We also have what is called Welcome Family, and our Welcome Family program is emphasizing this one-time free home visit from a public health nurse. And so while Healthy Baby, Healthy Child is more of an ongoing home visiting program, Welcome Family is actually a program that's designed, like within its name, welcoming family to this new idea of parenthood. And so any family who has given birth in Boston within the first 8 weeks has access to this program to meet with a public health nurse to kind of emphasize a lot of the information, adding more hands on deck, having more eyes, more providers kind of available to you to check in to make sure that you're doing well. Welcome Family does that. It allows families who have just delivered within the first 8 weeks to have this one-time free home visit from our public health nurses. And it's actually a lot of times through this program that families get referred into our Healthy Baby, Healthy Child program to continue receiving these ongoing home visits from public health nurses. We also have our Early Childhood Mental Health program that works to sustain a system of care that meets the mental health needs of children from birth to aged 4 years old. And then we also have our Father Friendly initiative, which is our father-centered programming. Oftentimes fathers are left out of the maternal and child health conversation. And so our Father Friendly program is really focused on supporting fathers, making them feel a part of the process, having them feel more connected to the process of pregnancy and postpartum and all of those things, and also just making sure that their needs are met as well. And they focus also on addressing legal challenges that fathers might be experiencing and helping them navigate those things and providing resources for them to set themselves up for success. We also have what is called our Healthy Start and Housing program. And our Healthy Start in Housing program is a pathway for some of our high-risk families who are pregnant and parenting that are housing insecure. It allows them a pathway to get permanent housing, but also working with the care team that helps them sort of think about all the different things that they need to have in order as they sort of take this new journey of housing stability. We also have a Love for Latch campaign that is also through Boston Healthy Start Initiative that we are really excited about. It's a new campaign that we just launched recently this past August for Black Breastfeeding Week. The campaign is focusing on activating community and empowering families around breastfeeding, not only initiation but continuity. And so a lot of families have the desire to breastfeed. A lot of Black families, families of color, have the desire to breastfeed, but then they encounter a number of barriers that allow them to not be able to maybe meet the milestones that they'd like to reach. This campaign is really a desire to help support families and also expand what we would like to call a breastfeeding empowerment zone within the city, to look at visibility, making sure that folks know that they're not doing this alone, that we see them and that they feel seen when it comes to all the work that they're doing around breastfeeding in their own breastfeeding journey. Also emphasizing the amount of importance that it takes for family to also contribute to a woman's desire to breastfeed or a lactating person's desire to breastfeed. Also calling community to action. So what are the appropriate infrastructures for family who want to breastfeed? So one of the huge accomplishments that we're proud of through Love for Latches is being able to bring a breastfeeding pod to the bowling building in Nubian Square. It's been a really exciting journey in seeing the response that we're getting from this campaign itself. A large part of our work is based on partnerships and other community programs that really help to address the needs of our families in a big way. We also have a food pantry in Mattapan, and in addition to that, we also partner with Little Cocoa Bean Co., which is a toddler cafe that's really focusing on addressing nutrition as it relates to early childhood development. So we do nutrition classes every Wednesday at Little Cocoa Bean, where families who are weaning from breastfeeding have the opportunity to think about how to create their own baby food. It's a really neat experience of being able to just kind of blend what you have around, what you're accustomed to culturally eating. And so embracing that idea of using your cultural foods to also be a source of nutrition and comfort for yourself and for your children. The course is specifically for families in our program that have small children. We also have behavioral health support groups, which right now is really focusing on the postpartum period. Little Cocoa Bean gives us the opportunity to host in-person groups in a very welcoming environment that our moms truly enjoy and discuss various things like what happens to you mentally, emotionally, and physically during the postpartum period, especially for Black women who often don't report instances of perinatal depression and other mood disorders. And so it's an opportunity for us to debunk some of those things and really get into details about normalizing these experiences and then how to navigate resources to help support many of the women who are experiencing these challenges. And I also say that the support groups have given us an opportunity to allow families to expose their children to this space. And so we're doing these groups for moms, but at the same time, we're providing childcare for their children to come and participate in all of the different things that are available through Little Cocoa Bean. And a huge benefit of that is families that come through this program also have access to Little Cocoa Bean and the food that's available through the cafe anytime that they need, and it's all free. So we're really grateful to the partnership that we have with the Little Cocoa Bean, and it's because of our partnerships that we have within the community that really help us to push this work forward in a real way.